Hi everyone, in this video we are going to talk about the how AI is used for the doctor profession. AI can be used for any profession, but in this particular video we are talking about doctors. AI is an efficient assistant in any profession you are. If you are using a proper prompt and a proper knowledge base, the AI will be very smart that can help you at any extent. But in this demo, we are not going to use any OpenAI or Gemini, the paid versions of the LLM, large language models. Instead, we are using the open source large language model Llama 3 for developing our chatbot in our local machine. It is very cost effective because we don't have to pay any amount. At the same time, because the application is available in our local machine, no internet is required, and at the same time the data is so much secured because everything is in our machine, and that is separated from the entire world because it is not having a interactions, internet connections. It doesn't need any internet connection. You can ask any question and you can get a response. Everything is in your hand and everything is in your system. You don't have to reveal to anyone in the world, by which it is so personalized and it can be so secure. We can talk about how it can be beneficial for having a local chatbot, local LLM chatbot in our system. Why do doctors need their own chatbot? The important benefits we can get by having the chatbot with us are time saving, and it is always available, and it is highly personalized, it is so secure, and it is cost effective. Time saving means you can quickly retrieve disease summaries, drug interactions, or case guidelines. If you prescribe a number of drugs, how it can be interacted, you can get a result immediately, and that can be communicated to the patient. And it is always available 24/7 because it is the machine that is available with you. So at any time, if you want any assistance, you can ask the chatbot, and it is available to you by 24/7. Personalized, trained with your own notes, patient FAQs, hospital protocols, or specialty documents. You are going to train the large language model with your own data. This data can be grown with day-to-day life data collections, or if you are attending any seminar, you get the collection of data that can also be used for our knowledge base. So it is so personalized. What kind of knowledge you need and what kind of knowledge you don't need, all those are in your hand. You can build up your knowledge base at your convenient. The next benefit is secure, because once you have developed in your system and the local LLM is running in your machine, then it doesn't need any internet. That means your data is yours. You are not going to connect with the world with any internet. You are not going to connect with any cloud. So whatever the data you have collected, and whatever the questions you are asking, and whatever the response you are getting, all those are in your system, and it is in your control. The next benefit is cost effective. If you are going for ChatGPT API or Gemini API, you have to pay monthly cost. You have to pay as you are using the data, no monthly fee. So you don't have any control in spending the money. But when you are having your own local LLM ChatGPT in your system, initial setup is recurring amount, but once it is set up, you don't have to pay any money. So it is so cost effectively. Next, we are going to watch a demo. It is a simple demo developed in my own system. the system configuration is somewhat limited, and I am not a doctor, so my knowledge on medical domain is very limited. So and the questions are at the surface level, not at the deep level, but at the same time we can understand how AI can be useful in the doctor profession with this simple demonstration. Okay, let us move to the demo. This is the LLM I have developed in my machine. I am using in the browser. We can see that in the URL is my local machine URL. So it is created with the data I have got for a doctor. He is a MBBS doctor who has just started his practice. The document has a limited information because I am not a doctor. So as far as I know, I have created a document, and the machine is also limited, having a limited configuration. So if we have a more configurable and we have a deeper knowledge, then the application will give any response that you want. So the advantage is whatever the question you are asking, that is private, no one will know. At the same time, the response is also under your control. What are the document you are giving as a retriever, that will create a context for your response. So the response is also accurate as well as very you can get it as you want. So it may be 400 or thousands of pages. So you can ask the questions, and the answer would be using your document to get the proper response. That is the advantage of having a local machine, local LLM in our machine. In this chatbot, the first question we are asking is, what are the most common cases seen in general practice, and how to build rapport with the patients for one of the common cases. When we run this question, the response we will get in 17 or 18 seconds, I think, or it may be 20 seconds, because it has to analyze the documents what you have loaded. Once it comes with the answer, we can give what is the response we receive. 1 minute, 1 second. I think it is coming out with a proper response. Yes, this is the response. So based on our question query, the most common cases, it seems that these are the more blood pressure, diabetes, colds and flu. All these are it is giving us a common cases when you are practicing in your clinic, and it is also giving how you can build a rapport with your patient, the step by step, by which you can also understand how you can have a communication with your patient. So this is the answer we have got for the first question. Second question is, I am a less experienced doctor and I joined a hospital for general practice. What are essential clinical skills I must master? This is a question we are going to ask the system, ask the chatbot, and the answer we are getting is, it would take some time, as you know that it is analyzing the documents what we have loaded in the systems. So yeah, we have got these are all as a new doctor, and the communication skills should be better. Medical history taking, how you are taking the medical history, physical examination, diagnostic skill. These are all the some of the skills you have to develop when you are entering into the into the medical hospital as a new doctor. So these are all the skills you should develop. The third question we are going to ask in the chatbot to the LLM is, while diagnosing the sick of patient, what are some common mistakes doctors must make when taking a patient medical history, and how that can be avoided? When we run this one, as usual, it takes some time. It may be 15 to 20 seconds. So let us wait what kind of answer we are getting for this query. This kind of queries we can ask based on our experience also. So these are, according to the text, some common mistakes doctors make when taking a patient medical history include. According to the text, what does it mean is, this is based on the documents we loaded for our RAG systems. So based on that one, the mistakes the doctor is doing is, most of the common mistakes are not listening actively, interrupting the patient, failing to maintain eye contact, using yes or no questions instead of open-ended questions. To avoid these mistakes, giving the patients space to share their concerns without interrupting, maintaining eye contact with the patient, using being attentive and listening actively. These are all some of the ideas our LLM is giving to the doctor to avoid the common error happening in interacting with the patient. The fourth question we have asked is, what are some strategies for managing difficult high risk patients? The response we have got is, after 15 to 20 seconds, we have got the response as establish trust, use clear and simple language, focus on patient centered care, use non-verbal communication effectively. So you have to use the eye and hand movement to explain the details instead of speaking too much. Stay calm and composed. Whatever the patient is creating, if he is speaking angrily or what, you have to keep you have to stay calm and composed. These are all the advices given by this chatbot. The fifth question we have asked is, when can a doctor refer to other specialty doctor and how it can be communicated to the patient? So the response we have got is the complex cases, when it is a complex cases, or when it needs specialized care, or the doctor has a limited scope of practice. How to communicate to reference? Explain the reason, provide options, emphasize patient safety. So these are the way you can you have to maintain while referring the patient to another one special doctor. So the example script is also given. So I want to discuss your unfortunately my scope of practice does not allow me to provide specific service. However, I have referred you to a specialist who will be able to provide the care and attention you need. This specialist has years of experience in and is highly respected within their field. So these are all this is an example it also gives. So based on that example, we can interact with the patient.